Good morning, friends. Welcome back to Medical Classes by Dr. Srinidhi Kumar Acharya, my YouTube channel. And please subscribe my channel and also please give your valuable comments. So we were discussing about history taking, and today we will have another important part of the history taking, that is treatment history. Okay. Now the treatment history is also very important. After completion of the past history, family history, then we have to go for the treatment history. In the treatment history, the details of the treatment which is taken so far for the present illness, that has to be taken. Okay, in detail you have to take what are all the medications which are given for this particular illness, and also what are the medications which was taken by the patients previously. That has to be also asked. Now suppose if there is a history of previous medication, maybe 1 year back, 2 year back, whatever, or some ongoing medication is there, then that history plays a very important role. Now, previous medication, suppose a long-term medications like child has taken medication for tuberculosis, anti-tubercular drugs has been taken. Now, we know that when the child is taking anti-tubercular drugs for 1.5 months, or different schedules are there, 1.5 year and all those things. And now, some of the adverse effects of that particular drugs are most expected. Okay, maybe liver toxicity, renal toxicity, arthritis, and so many other problems. So now, the present complaint by which a patient is coming to you, child is coming to you, may be an adverse effect of that particular drug. Okay, for example, arthritis. Arthritis is quite common in all the common complication of all the anti-tubercular drugs. So presently, the person who is coming with the arthritis may be because of adverse effects of the drugs which he has taken previously. Okay, that's one thing. Then again, a child is coming with the RHD, rheumatic heart disease, and the child is telling that once in every 21 days I used to take an injection or a medicine. Okay, so that itself gives a clue that yes, this is a patient of RHD, because in case of RHD we usually give the Penidur. Okay, so usually it is prescribed, which has to be taken in once in every 21 days or once in a month. Okay, that's a long-term treatment, almost up to 30 years. To prevent the possible valvular injuries, etc. Anti-convulsive drug, a patient coming with a patient taking anti-convulsive drug since long time, so he will come with so many complications or adverse effects like gum hypertrophy, learning disabilities, and many things. Okay, so then similarly, anti-thyroid drugs or drugs taken for the thyroid hypothyroidism, anti-malignant drugs, steroids, especially steroids, a lot of steroids taken in the early part of the life, that leads to growth retardation, then hirsutism, then short stature, then the excess accumulation of the fat, Cushingoid-like syndrome. So these are quite common with the steroids. So history of a treatment history is of very important. Okay, so as I told, the recent complaints may be because of the complication of the drug therapy which is taken. Now this is about the previous medication. Suppose the patient has got one present symptom now, and for which he has taken some of the medicine. He is not cured, therefore he is coming to you. So then you have to inquire what are the treatment that has been taken for this particular problem, and whether this treatment is justified, which is given, whether it is given in underdose, whether it is given in overdose, or whether there is any modification required on that. Okay, and whether it is a short-term complication of that medication. So that has to be understood. Or we have to also see that whether some unwanted antibiotics are given. Okay, unwanted medications, antibiotics or anything, medication, because unwanted medications may itself lead to so many problems. For example, when there is no requirement of any antibiotics, especially the ampicillin derivatives like etc., and the patient has been given with the antibiotics, and he may start with the diarrhea. We know that pseudomembranous diarrhea, okay, which disturbs the gut environment, and so that may be the presentation. So that has to be also understood. Unwanted steroids, unwanted antibiotics, so that has to be seen. Duration of the treatment, sometime the duration is not followed, sometime doctor is not telling, and sometimes the patient is stopping the medicine abruptly in between. Okay, once he got little relief, so that may be the problem. So again, in the treatment history, you have to also take the history of drug hypersensitivity. The history of drug allergy is there, so that has to be identified, because that helps to you also to give the medications. Okay, so it also guide you, okay, which medication has to be given, which medication should not be given. Usually we will go for some the sensitivity test before giving some of the antibiotics, but still this history will going to help you a lot. Drug reactions, previously there is a history of drug reaction, that has to be also inquired. So these are some of the important points that you have to take in the treatment history. Now coming after treatment history, coming to the one more important part, that is personal history. Now personal history is very important. When there is no clue about any systemic involvement or site of the lesion or site of involvement, then personal history gives a lot of information. Suppose a fever is there, okay, unexplained fever is there, not identified since last 10 days, and there is no localization of the disease. In that time, personal history will going to help you. Suppose personal history, child is telling the loss of appetite, okay, loss of interest, child is loss of weight. So this type of personal histories, these are considered as constitutional symptoms. So they helps to guide you to a particular disease. Okay. So in case of childhood tuberculosis, actually you don't have any much presentation except a low grade fever which is continuous. But when you ask and even there is no any systemic involvement also, like cough and all, cough, cold and all. But when you ask the constitutional symptoms or in the personal history, you find many information. Loss of appetite, so very important clue. In children especially, loss of weight, very important clue, loss of interest. Okay, so therefore personal history is very important. Of course, in children it is very difficult to take also, because most of the time we have to rely on mother also. Okay, so if the child is more than 5 years and all, okay, we can get some information. Otherwise, we should be totally relying on a mother. Okay, so chance of error is also there. Anyway, what are the important things that has to be asked in the personal history? Number one is appetite. Okay. Appetite, in Ayurveda we say aruchi is there, ananabhilasha is there, ashraddha is there, aruchi is there, abhipaka is there, okay, and then becomes arochaka is there. So there are different terms of bhaktadvesha is there. So different terms are there, and every time some of these terms are physiological, some of them are pathological, and some of them are psychological. That we will see in another important class. Okay, so anyway, appetite, you should ask, what is the important question that you ask in the appetite? Appetite, you will ask whether appetite is altered or unaltered. That's number one. Okay. If appetite is altered or unaltered. If it is altered, okay. If it is unaltered, it is okay. If it is altered, whether it is altered before the onset of the presentation of the symptom, or before the presentation of the symptoms, or after the presentation of the symptoms. Now, suppose if child is coming you with the fever, viral fever, and if you ask the appetite, definitely appetite is get altered, no doubt. But before the fever itself also, if the appetite is altered, okay, like tuberculosis and all, that's of very much significance. Okay, so appetite is altered or unaltered. Unaltered, good and well and fine. If it is altered before or after, okay, if it is before, suppose, or after, anyway, then you have to, which type of alteration happened, whether it is increased, whether it is decreased, or whether it is voracious. Okay, so this much of information should be taken from the appetite. If it is decreased, okay. If it is increased, it may be seen in thyrotoxicosis, diabetes mellitus, okay, many conditions. Sometimes it may be voracious, okay, thyrotoxicosis may be voracious. So this has to be taken. Now, sleep. Another important personal history is a sleep, about the sleep. Now, sleep, you may interpret as sleep is sound sleep or disturbed. There is no good and bad sleep. There is no good and bad appetite. So we cannot grade the appetite like, because appetite is highly individualistic. Okay, therefore it is a altered or unaltered. Sleep is sound or disturbed, either the sound or disturbed. If it is sound, for how many hours patient used to sleep, okay, at what time, what is the bedtime, and what is the arising time, awaking time. Then if it is disturbed, then you have to ask many questions. If it is disturbed, whether there is nightmares, or whether there is early awakening, or whether there is late going to the bed, or whether there is an untoward incident during the sleep, for example, sleepwalking, sleep talking, etc. Or if there is any problem which makes the child to get up from the sleep in the midnight. Okay, suppose bone pains, okay, usually in case of leukemia. So what actually happens is baby wake up in the midnight and crying because of this bone pain. Okay, okay. So all this information has to be taken in the sleep. Disturbed means what are the things? The sound means for how many hours, and this information. And another is sleep hygiene. You have to also ask about the sleep hygiene. What is sleep hygiene? Sleep hygiene means whether he is following the same pattern of sleep every day. So every day he is going to the bed at 10 o'clock, getting up at 6 o'clock. This is a very good sleep hygiene. Okay, no, he used to wake up till 2 o'clock and get up very late in the morning. So this is improper sleep hygiene. Next, you have to ask about the bowel habits. This is again the personal history. You have to ask about the bowel habit. In the bowel habits, you have to see, suppose defecation, you're asking about the stool. Now, frequency of the stool, character, then again the amount of the stool which is passed, consistency of the stool, whether any foul smelling from the stool, or whether it is with the blood, or whether it's training for the stool, helps to identify the constipation and all, whether it's a very hard stool, or what is the color of the stool. If everything is fine under normal limits, then you can consider stool is regular. Okay, bowel habits are regular. Otherwise, you cannot say it's regular. Similarly, for the urination, you have to ask the urgency, again the frequency, overactive bladders, then amount of the urine passed at a time, whether there is an obstruction, passing with the pain or without pain, passing with the blood or without blood. Okay, so all this information has to be taken. What about the standing urine? Any color change in the standing urine? So this has to be taken. Okay, now next is about in the personal history. One more important issue is diet. Okay, you have to ask the diet of the child. It may be vegetarian diet, it may be non-vegetarian diet, or it may be mixed diet. Okay, sometimes they may be having the strict vegetarians, or sometimes they may be consuming the excess junk food and outside food. This is one important part that you have to ask. Again, in the diet history, whether they are taking the natural food or artificial food, and whether again in the diet, whether homemade food or outside food. So that has to be asked. And timings of the diet, we call it diet hygiene. Okay, diet hygiene, timing of the diet, whether they are taking the food every day at a fixed time, or whether they are very, very irregular in food intake, and how the diet has been taken, all the family members sitting together and taking the diet, or individually taking the diet. So all these aspects has to be taken. Inquire. Now look at some of the habits. Okay, habits, for example, habits like habit is one more important personal history. And the childhood, usually we will assume that they don't have any bad habits, but still if the parents are having the bad habits, they may have the impact on the child also, passive smoking and all those things. Okay, now smoking, then alcohol, tobacco, coffee, tea, then carbonated drinks, etc. has to be affected. Now adolescents boys or adolescents boys and girls, so they may be the victim of all these bad habits. Okay, smoking, alcohol, etc. So in that condition, you have to take the thorough history of the habits in the personal history. Then one more important thing is the smaller kids or childhood, early childhood period, that's the habit disorders. Okay, so that portion has to be also covered in these habits only. Thumb sucking, nail biting, okay, some other the tics, okay, head banging, okay, vocabulary habits. So this has to be also inquired in the list of habits. Okay, so lastly, you have to ask one important question in the personal history, that any of the constitutional symptoms. Okay, you have to ask whether there are any constitutional symptoms like loss of weight, loss of appetite, which is more subjective. You cannot express it, isn't it? Personally, I can feel, yes, I am very dull, but a person in front of you can tell you, no, you are not dull, you are very active, but from inside you are feeling that I am dull. Okay, such a type of history, which is totally personal to me, can be taken in this context. Okay, loss of weight, maybe loss of appetite, dullness, and disturbance, irritation, body pains, loss of interest. So such personal points can be also asked in the personal history. So this is all about treatment history and adult personal history, which is very, very important in the pediatric history taking. In the next class, we will again meet with another important class. Thank you very much.